Focus over to the national capital as air pollution spikes across Delhi NCR. Hospitals are seeing a surge in patients with breathing problems, even asthma attacks. At Central Delhi's Ram Manohar Lohia Hospital, a specially designed OPD caters exclusively to cases triggered by air pollution. This clinic features multiple OPDs staffed by 4 respiratory physicians, a skin specialist, an eye specialist and a psychiatrist to treat patients with chronic conditions. Children and the elderly are particularly vulnerable. While last year only 5 to 7 patients visited this OPD daily, today the number has risen to 20 to 25, with many learning about the clinic through word of mouth or media coverage. CNN News 18 brings you this special report.
It's that time of the year again when hospitals begin to see an increase in number of patients coming with symptoms of breathlessness, cough, wheezing or asthma attacks. Blame air pollution. Today we are at Central Delhi's Ram Manohar Lohia Hospital at its uniquely designed outpatient department to handle cases triggered by air pollution. This clinic has multiple OPDs with 4 respiratory physicians, 1 skin specialist, 1 eye specialist and 1 psychiatrist to consult patients with chronic diseases. Children and elderly are the most vulnerable, also pregnant women. Last year, only 5 to 7 patients were coming to this OPD, but today, for the first time, they have seen more than 20 patients coming in. Till last year, we are told that 99% of the patients who come to this OPD were transferred by the medicine OPD, which takes place in RML in morning time. However, today there are many patients who are coming for the first time after reading the advertisements or hearing from their neighbors or other people that this sort of OPD is being organized at RML. We have seen many young patients also coming to this OPD to discuss the reasons behind the irritation in their eyes or irritation on their skin or the long prolonged cough, wheezing and other symptoms which they presume are being triggered by air pollution. Please let us know this concept, that how this concept was incepted and then what is the response?
Yeah. Well, basically the idea behind this concept was to create awareness amongst the general public that the problem that they're having is because of pollution and not otherwise. So to counsel them, to educate them, because people were being treated even earlier with pollution related problems, but you see they probably never knew that the illness that they had increased was because of pollution. So that's very important.
Do you find any difference in this year's OPD in comparison to the last year? Do you see an increase in number of patients?
Well, because as I said, people were already being treated in different departments in our hospital. So, there was not so many people coming to this particular clinic, despite the fact that we have huge numbers of patients who are suffering because of pollution. So initially last year there were only around 5 or 7 patients coming in a day, but today there are more than 15-20 patients already and more are trickling in.
And what are the chief complaints? What are the chief complaints, or if I can say that, what are the top symptoms that people generally come up with?
Well, when the air is polluted, it impacts initially those organs of your body which are in direct contact with the polluted air. So your lungs suffer the biggest hit.
मेरे को सांस फूल जाता है, एक यूआई जैसे यहाँ बढ़ता है, परालियाँ शुरू हो जाती हैं, तो और जितने भी ये मतलब कंस्ट्रक्शन वर्क है वो शुरू हो जाता है, तो उससे हमें जो प्रॉब्लम होती है, हम अपने अड़ोस पड़ोस वालों के बहुत बार कहते हैं कंस्ट्रक्शन मत करो, वो ऊपर से कूड़ा डालते हैं और गंदगी होती है, उससे जो है हमें दिक्कत होती है।
AQI का इससे क्या लेना देना हुआ?
AQI के ये होता है जो ये मतलब पराली वगैरह जलती है या मतलब है कि ये गाड़ियों का धुआं है या और दूसरी चीजें, AQI मतलब 200 से ऊपर हो जाता है तो हम लोगों के लिए ऐसे नहीं हो जाता, हमारी छाती में दर्द होना शुरू हो जाता है। चेस्ट
Doctor, what are the top complaints that patients generally come up to you?
Actually, a lot of patients are coming with symptoms of coughing, increased tightness of chest, and already some patients are chronic patients with asthma and COPD. Such patients are coming with increased exacerbations, infections and all, and other complaints such as burning sensation of eyes, skin problems, and even psychiatric symptoms such as anxiety also they are coming.
So these patients are being treated in the OPD only, or you have been seeing certain cases where there is a need for admission as well or immediate attention?
So many patients are coming in OPD, not only in OPD, casualty also they are coming in emergency exacerbation.
What are the precautions that people can take to prevent either their exposure from air pollution or the symptoms that are triggered later?
Yeah, to prevent the exposure to pollution, most important is N95 mask. Like we have seen in the COVID, if worn properly, that this will limit your problems to a great extent. N95 mask, the surgical mask or cloth mask is not at all effective.
And so what about the indoor pollution? Do you think that air purifiers play their potential?
Yeah,
There is a role?
definitely. Air purifiers have a definite role. They can be used, they should be used.
And very important for the vulnerable population such as pregnant women, elderly people, children, how to limit their exposure or how to keep them safe as much as we can.
Avoid outdoor exposure and use air purifiers, don't open the windows.
Interestingly, this is just ahead of Diwali and despite the firecracker ban. We'll keep bringing you all the latest news stories, but for now, we cut to a quick break.